I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
This is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, the Long Island Vaser Lipo Center, and this morning I'm doing actually a touch-up on this young man. He drove in from one of the southern states down there, East Coast, and for a touch-up, very slight touch-up of his gynecomastia surgery. He had it done November of 2016, so almost a year ago. And as you can see, he's got a pretty good shape. I did Vaser high definition lipo sculpture on him through my old entrance points right over here. That was about a year ago, here and over here. Now I transferred this little scar site into the armpit, so you don't even have this. And that way I can also better get this. And that's what really bothers him. He likes his chest, especially on the right side, but he wants a little bit more over here. And through my thousands and thousands of these gynecomastia surgeries and my expertise in thinking about, how to perfect it, how to make it better, I transferred this incision up here. Number one, it's hidden, and number two, I can get better this upper lateral aspect of his pectoralis major muscle. Now, most people will say, he looks amazing, which he absolutely does. We're going to show you his pre-op photos from a year ago, and you can see for yourself. He's got a beautiful negative space here, a little bit of the lats here, and the lateral aspect, as well as the inferior aspect of his pec muscle. But I'm going to even make it better. His left chest, as you can see, has a little bit fuller. But as you can see by the pre-op photos, showing you again, this chest was a lot different. The nipple was bigger and lower, and so we're gonna hit this side a little bit harder, more harder than the right side. The right side, he needs just a little bit of fine tuning. The left side, again, from this incision over here, get better here and get better here. We do not have to make the incision by the nipple because he's got no gland. I just want to Vaser and lipo sculpt his chest a little bit better. Teeny bit on this side, a little bit more than teeny bit on the left side for perfect, extraordinary results. And I feel that if somebody wants a touch-up, and probably 99% of people would say, "Oh my God, I love this, the size and shape of his chest. I'm fine." There's people who say, "I want even better," and as long as I know that I won't hurt them, I will make it better. Without an argument. So in a minute we're going to mark him. In a minute we're going to take him to the operating room and do this touch-up. See you there. And I want to add, I didn't mention, I now add this deltopectoral groove. He's a good fit guy. He's got the groove. I'm just going to deepen it just a little bit, give him a better definition to the pec muscle. You all right? Yeah. All right. And finally, just little stealth incisions right into the armpit right there. So they're hidden, and I can also get at this area a lot better rather than my old incision right over there. Good. Okay, lift up your army, and we're going to give some Novocaine. So here, my old incision, you can't even see it, really, somewhere here. I don't even know where it is. Maybe over here. He heals up great. But now we're gonna do it right over here, so it's in the armpit. And you don't even see it. It's that small. So this now protects the skin. It's got those little plugs. So, because it works on steam heat. He's a redo. His right side is pretty perfect. This side right here, it's pretty perfect. He wants me to hit a little bit over here more, so I'm going to scoop down over here. So I'm going to do less time and less energy on this side than on this side. This is ultrasound energy. Go through these little ports, these protected ports. I'm going to protect the skin so we have no burns. Turn your head to the left, and that's about it right here.
Melt that. Create that hockey stick boomerang shape arugio. We're done with the Vaser. So we're done with these protective, and through these same holes, we are going to hook it up. This is my Power X. It twists and turns courtesy of the Doctor's Toy Store in South Florida. So here we go through the same stealth incision holes. This twists and turns and suctions. So it really, and it's all been melted. So really, it's more of a vacuuming and liposculpting than liposuction per se. That's the fat taking a holiday. The ring dings, cupcakes, bagels with cream cheese. Create a negative space here. Beautiful negative space. Right there, you can kind of see it already. Right there, that little groove. Okay, so these are my curved cannulas. I can go in there again in my stealth incision and kind of curve around to give that shape to the pectoralis muscle. It kind of can curve, get the inferior without making an additional incision.
I just had the surgery done on a touch-up Gynecomastia Vaser Lipo with Dr. Lebowitz. I think it overall went fine. Didn't really feel much pain. Just looking forward to getting this, the recovery done, and hopefully in a few weeks come back to check out my results. And this should be the last, I hope. And I'm really looking forward to the results. Dr. Lebowitz is great. He's a caring doctor, and he will definitely tend to your needs as he did to mine. And I'm very pleased with his level of expertise and his engagement into understanding what the gynecomastia problem is and being able to fix it. So thank you.